Hi, today we are going to talk about disorders of the nervous system. They're pretty interesting. There's a lot that I'm going to go over, and let's just get started. So first, there's headaches and migraines. You may have experienced some in your life. There's headaches, which is a pain in the head, and there's many types and many different causes. Maybe you didn't eat enough, maybe you are thirsty. There's a bunch of different causes for headaches, and there's different types. So if you're having a sinus headache, so maybe your sinuses are clogged, you'll feel that like kind of all from here, like spreading out. A tip to help that, sometimes if you press on the bridge of your nose, that may help relieve some of that pain. You may have a cluster, which is kind of all like in one spot in your eye, or maybe in like the back of your head, one of those things. Then there's tension headaches, which usually are in the front of your forehead. And then there are migraines. Migraines can last hours or days. There's usually severe throbbing and pulsing, and it's usually only on one side of your head. And it's usually paired with nausea, vomiting. You may be sensitive to light and sound, so you may want to be in a dark place. You may want to be in a quiet, dark place. You may want to just sleep it off or try to sleep it off. But it's very intense pain. That's very much the difference between a headache and a migraine. It lasts hours or days. There's severe throbbing and pulsing. It's on one side of the head, and it's paired with nausea, vomiting, or sensitivity to light and sound. Okay, next let's talk about concussions. That's a traumatic injury to the brain. So maybe you had a violent blow, you are shook, you're shaken, or you're spinning. So it's just when your brain has an impact. Okay, so there's different types. There's the direct impact, so maybe you fell on your head. Acceleration, deceleration, so that's like a whiplash kind of. And then a brain blast. Okay, that can cause immediate but temporary impairment of some brain function. So it might affect your thinking, your vision. It might affect your balance and your consciousness. So you may go unconscious for a few seconds. It's important when you have a concussion, maybe get off the screen, stop reading things, and just kind of relax and help that relieve its injury. Then there's amnesia. That's a loss of memory. That could be due to many different causes. So it could be a severe concussion. It could be through alcohol and drug use, trauma to the brain, or even psychological factors. So if you had severe trauma, usually in your younger years, that may be caused defense mechanism, and your brain kind of just wants to block out that memory. Okay. So there's other causes of amnesia. There's, again, psychological, aging. You may have epilepsy, all different types of things. Okay, and then there's some damage to the corpus callosum. So this can cause many different things. I'm not going to show this video. I will show it in class. The corpus callosum connects the left and the right hemispheres of your brain and allows information to pass both sides. Okay, so it's involved in memory, learning, executive functions, like 3D vision. So if you could tell that things are 3D and three-dimensional. And it also affects your visual reaction time. Some injuries or some causes or syndromes from damage to this include speech and movement ataxia, so that's a lack of control, or coordination of voluntary movements. So you may have involuntary speech. You may be saying random things in an order that doesn't make sense, or you may have involuntary movements. Okay. Then there's alien hand syndrome, which is very interesting. So that's when the left hand acts on its own without awareness. So if we look at this GIF, you could see that this person's kind of struggling and sees the right hand is kind of dominating while the left hand is kind of trying to do something else. Okay, so it's without awareness, it acts on its own. And then there's pseudobulbar palsy. That affects the ability to control facial movements. So you may not be able to control your facial expressions if you have damage to the corpus callosum. And some treatments to help with this, there are rehab exercises and speech therapy to help with your speech. Okay, next there's Parkinson's disease. That's a progressive disorder that affects your movement. You may have tremors, and it commonly causes stiffness or slowing of movement. So you may walk slower, you may be stiff and shuffling your steps with the stiffness. You may also have a mask-like face, so no real expressions. Okay. And often people with Parkinson's disease with their tremors have a hard time doing simple tasks like using a spoon. So I just thought it was interesting to point out that there are new technology to help with this. You see that spoon helps with those tremors and helps you do daily life functions. Something I just thought was interesting. Next is Alzheimer's disease. Again, that's another progressive disorder. That's when brain cells degenerate and die. You could see the difference between a healthy brain and severe Alzheimer's. You could clearly see that the brain cells just degenerated and died off over time. And this is a common cause of dementia. So dementia is a continuous decline in thinking, behavioral, and social skills. And some of the symptoms of Alzheimer's are difficulty with words. You may have poor judgment, memory loss. You may misplace some items or have difficulty solving problems or familiar tasks. And you may be confused with time and location. That's how my family found out my great-grandma had Alzheimer's. So confusion with time and location. She kind of didn't really know where she was. Next is a stroke. So there's when blood supply from part of your brain is interrupted, so it might be blocked or you might have a bleeding. So this brain tissue that's either blocked or the blood is not getting to a certain spot of your brain is deprived of oxygen and nutrients, and these brain cells begin to die in minutes, which is not good. So it's important to know some signs of a stroke. Just a reminder word, use fast. So face, arm, speech, and time. So F for face. If the face is drooping, that may be a sign of a stroke. If the arm feels weak, there's not a lot of control for your grip, that's another sign. Or they may have difficulty speaking. That's when it's time to call 911. Next is multiple sclerosis. That's an immune system disorder, but it's a neurological disorder, I guess. It's when the immune system attacks the myelin sheath of a neuron, which, remember, that is super important for transmission of the impulse for neurons, which cause neural communication problems. So without that myelin, that will cause communication problems between the neurons. Some symptoms may be a tremor. You may have some weakness. You may be uncoordinated or lose your balance. And there might be some disturbances in vision and speech. Okay. And this picture shows the top 5 signs of multiple sclerosis. There's cognitive dysfunction. So they have trouble with focus, processing info, and memory. You might have vision problems. Just note that people have vision problems and may not have multiple sclerosis, but a common symptom is that there's pain in one eye. Then there are balance issues. You may have issues with coordination again. You may be chronically tired, exhausted, and then lastly, you may feel depressed. Okay. Next is meningitis. That's inflammation of the meninges. Remember, that's the outside of the coverings of the brain. There's many different types of ways that you could get meningitis. There's viral, bacterial, and parasitic or fungal infection. So it's an infection. The most common in the U.S. is the viral infection. And this causes a headache, a fever, and a stiff neck. It is one of the most common symptoms. Okay. Next is sadly shaken baby syndrome. That is a common sign of abuse, and it's a life-threatening injury. It could cause lifelong disabilities or death. It occurs when the infant is forcefully shaken back and forth, or not held correctly, and they're like brought up not correctly. And that motion of that back and forth motion ruptures blood vessels in the brain and breaks neural connections. Okay, so that may also cause hemorrhaging, swelling due to that shaking. And at least 1 in 4 shaken babies unfortunately die. And those who survive may experience severe disorders like blindness, cerebral palsy, seizures, and other conditions. Okay. Next is Huntington's disease. That's inherited. It's an inherited disease that causes progressive breakdown of nerve cells in the brain. It results in movement, cognitive, or psychiatric disorders. Okay, so you may have language difficulties. You may have depression for the behavioral, or you may have poor balance. You may have impaired speech for motor symptoms. And as you could see in the normal brain, you see the normal brain, and then a brain with Huntington's disease, you can clearly see the breakdown of nerve cells in the brain. Okay. So next is shingles. That's a viral infection. It's the same virus that causes chickenpox. So usually when you get chickenpox, you are going to get shingles, unfortunately. It's painful, and it's a blistery rash that follows the path of one nerve. So you could clearly see like a path when you get these blistery rashes. And this virus lies inactive in the nervous tissue and spinal cord, and then sometimes it becomes active and flares up. Okay. So some early signs of shingles is a fever. You may have some headaches. You may be nauseous or chilly and have chills, or you may be fatigued. Okay, I'm pretty sure this is the last one. This is sciatica. This is pain along the path of a sciatic nerve. So remember, the sciatic nerve is the lower back. So it's going from the lower back through the hips, down to the buttocks, and down each leg. Okay, so that whole entire nerve right there, that's where the pain is going to be. And that usually affects only one side. It may be caused by a pinch of the sciatic nerve, so you may pinch that, or have been compressed on it for a long time. There might be a slip disc that pinches that nerve. Other causes are arthritis, diabetes, and just normal aging may break down that nerve. Things to prevent it: avoid cigarette smoking. That promotes the disc degeneration. exercise regularly to promote just healthy posture, and then use good posture and avoid sitting for long periods. Kind of ironic to say that during a time where we're all on our screens all day. Okay, so that's it. Thank you for watching. I hope you learned some new things about neurological disorders.